back in 2015, we had all these clinical trials come out and say endovascular treatment improves outcomes of stroke patients significantly. But despite that, about 50% of patients who underwent the treatment remained disabled at the even after receiving the treatment. So we have tried to understand if there's additional things we can do to help improve that 50% rate of persistent bad outcomes in these patients. And one of the areas that the field has been interested in is if we can make medical management better of these patients. And one of the areas we focus on is blood pressure, because stroke is kind of a blood clot that limits blood supply to the brain. Now we have treatment that takes off that blood clot, and suddenly you have a burst of blood flow to the brain. And so we don't know if we should keep the blood pressure low to kind of help decrease that sudden burst of blood flow to the brain, or just maintain a high blood pressure to allow for the brain to kind of recover from that persistent low. So it's kind of a dilemma either way. So we conducted this clinical trial to understand if low blood pressure or artificially lowering the blood pressure caused any safety concerns, or was it, was it giving us any signal of being effective at improving patient outcomes?